Ladies and gentlemen, if I can please urge you to take your seats. We're about to begin our next panel discussion. So we want to ensure that we give our panelists the full attention. May I please ask everybody to either take a seat or just to ensure that we have our audience area nice and well attended. It's wonderful to see you all here halfway through day 2 of day 3 at our inaugural Abu Dhabi Global Healthcare Week. And of course, this is the M42 main stage, which promises to take you through the most timely, topical, and urgent topics when it comes to the nexus that M42 represents. That nexus being health, sustainability, and technology. And we have been so privileged to have global expert speakers fly in especially, as well as our talent here in the UAE and across the region. The talent within the team of M42, wow, it continues to impress me. And my expert moderator who's going to be taking us through this session, we've given her a cast of thousands, as you can see. The seats are ready for our wonderful panelists. I'm going to invite her on stage with me. I feel like she's my co-host. And between us, we shall be introducing this session. So please give a big round of applause to the Senior VP of Clinical Development at M42, Dr. Fatima Reddin. Thank you. Dr. Fatima, grab your mic. Now, this particular session, we're looking at data-driven health.
Assalamu alaikum.
Unleashing AI's power in healthcare operations.
What an amazing panel, yeah?
And a very big topic area.
Oh, yeah, especially after morning sessions.
25 minutes on the clock. This is going to be a challenge, Dr. Fatima, but I believe you, above everybody else, can take on this challenge.
We'll try my
Your
best.
Panelists, I'm very impressed with the list of speakers. So between us, let's give them a wonderful, warm introduction. I believe that we have our very own M42's Safia El-Muqtari, who is a Deputy Chief Operating Officer at M42 and Acting CEO at Mubadala Health Dubai. Give Safia a big round of applause.
Please.
Robert Adam Griffiths, the Senior Director of Clinical Operations at M42. Claudia Suarez, who's a Senior Director of Clinical Operations at HealthPoint. Gaurav Dixit, the Executive Director, IT Strategy and Governance at Cleveland Clinic, Abu Dhabi. And Miriam El-Dahari, the Executive VP, Group Procurement at M42. What a wonderful cast list. Give them a big round of applause, and the stage is yours.
You know what, Amandeep? I'm extremely honored to have all this amazing team on stage. It's very, very, very difficult to have them. Okay. Really, thank you for being with us today. It's an honor to have you together. Thank you. I think that all of us are impressed after the announcement of our advisory board. It's really amazing to have Dr. David Rowe, Microsoft, in fact. It's amazing to have Professor David Sinclair. It's a professor of genomics. It's the father of genomics of Harvard. And it's also great to have Dr. James Mould. It's a lot of technology of AI, of genomics. Okay, we have the best of the best at M42. Let's see, on an operational side, are we prepared? What are we doing? And what's next? Each one of you is having an area of interest, an area of expertise. Each one of you is representing one of M42 assets. Let's see what are we doing on the ground with AI and what's next with you. Let me start with you, Robert. Robert or Adam? 15th generation of Robert. Let's go with Adam. Then Adam. You are, in fact, the Senior Director of Operation in Imperial College London, but also you are the operation leader for the primary care within M42. Then the golden standard in healthcare is a patient-centered care. How is AI, in fact, proving patient-centered care? Is AI supporting the patient-centered care? Tell us more, please.
Thank you. Thank you for the invite. Thank you for the ability to talk. So, in response briefly, yes, it's making a big difference. And I would probably split it into two direct responses. First thing first would be around resource allocation. So I've been working in healthcare management for 25 years. And if we take you back maybe 20 years ago, I was writing rotas with a piece of paper, a pencil and a rubber, and making several changes along the way. Now I can use innovative tools, AI, to predict what the next 6, 12, 18 months is going to look like for my staffing based around my patients. And it can predict almost down to the individual who I need where, when, and why. So it's right patient, right time for the right staff member. So much so it can adapt on the day to sickness, illness, and any other changes it needs to. I think if you then focus back to the individual patient, which is probably more key, if you look at how we are expanding to precision medication through genome, through mapping of demographic, age, even regional variation for treatment of care. If you look at diabetes, the prevalence in the UAE and the GCC, significantly higher than it is in Western Europe and some other countries around the world. So we adapt to that, and AI helps us to adapt to that and make sure that the treatment we're delivering to the individual patient is as at the forefront of what it could be and where it could be in world treatment, not just in region. So I would say we use AI for genomics, but also for demographics and the way in which we look to manage that patient, not just on today's occurrence, but for the next 6, 12, 18 months. It's more about preventative medicine than treating the disease that you're seeing on the day. So I think genomics is probably the way forward in terms of how we look at pharmacogenetics, and that's the big piece of work that M42 are leading the way on. And I would probably say that's where I'm going to see the next evolution in treatment over the next maybe 2, 3, 4, 5 years now for our patients.
Any difference in your operation between the primary care and ICLDC?
Okay, so the true bit of me should say no. You should receive the same treatment no matter where you come. So it doesn't matter if you come to M42 and present it primary care on Al Bandar this morning or ICLDC round the corner here. You should receive the same level of treatment. And that's what AI is doing. It's taking out social bias. It's taking out racial bias. It doesn't really matter where you came from in the world. AI can look at you as an individual and make sure that treatment is tailored to your need and your exact requirement at that point.
I mean, this is maybe meeting the wish of our group CEO in the morning, saying that what we are wishing to do is really accessibility and it's really equal treatment that we want to deliver to everyone. So I think that you are 100% there aligned with that.
That's pretty much totally the point, isn't it? And let's be honest, let's make it work here and then give it to the world. That's kind of the point, isn't it? Is let's get it right in our specialist treatment centres and then expand that out to everybody else to make sure we share that in that kind of socialist model of let's do the best for everybody.
Thank you. And I'm sure that with AI, this is easier than paperwork.
It's significantly easier. It takes a while for staff to trust in it. If I'm honest. So if you look at 20 years ago where nurse consultancy started and the physicians, certainly across the NHS, were very nervous that nurses were taking their jobs. There's more consultants in the NHS now than ever, and there's more nurses coming behind them. So they take on a proportion of work and they push the group up beyond them further. Same principle with AI. I can't see that, we as a world are growing in population, aren't we? We're not stopping. We're at over 8 billion now. So we'll always need hands-on healthcare. This is about how do we deliver the best to the most. I don't think we're ever going to see a drop in healthcare staff. What we're going to see is change in how they deliver healthcare.
Thank you so much, Adam.
My pleasure.
Safia, as a group COO and also as a CEO of Mubadala Health Dubai, my question to you is, how is M42 looking at using the power of data as custodian of the UAE genome program? We are very proud, in fact, of this project. How are we going to protect it? What's the next step with this project?
Thank you, Dr. Fatima. I think it's important to put things in perspective and for context. The UAE has made strides through the UAE Genome Project to accumulate or to collect more than 500,000 samples today of Emirati genomes within the span of 2 years. This is a huge amount of data that we've collected, and for context as well, The size of one genome takes up more than 3 GB, which means this is massive amount of data analytics that's required, and the AI helps us do that, specifically for a cohesive group of population, which is the Emirati population. So AI is the way forward in terms of the genome sequencing, in terms of data analytics, and with that data analytics, it helps us also do a lot of the research that's required for drug discovery that's required only for Emirati population. That's not necessarily, that's been using drugs that are formulated maybe in the West and do not have the same efficacy here in the UAE. I'll give you a good example. One of the first pilots on the UAE Genome Project with the collaboration of Department of Health used breast cancer on Emiratis females. And what they discovered in the first study is the screening is required for Emirati women well below the 40 years old, which is the clinical guideline today, which means that Emirati woman needs to start screening at the age of 30 because their presence or prevalence of breast cancer is different or higher than the global trend. In addition to research for drug discovery, AI will help us also on identifying mutations and variants that are specific to the Emirati population and can be expanded. So once we do all of this work, we can expand, we can replicate the same methods, the same algorithms in other populations. So the UAE Genome Project, or M42, is now expanding and replicating this program across the globe with other GCC countries who would like to use the same methods and identify preventative methods from the use of AI. So once we are really working on the AI front using these tools for analytics, we can move into the reality of preventative medicine or precision medicine. And this is aligned exactly with what the discussion that Hassan Al-Nuwais was our group CEO and Managing Director mentioned in the morning, that we really need to move from healthcare to health. Prevention, identifying diseases early on, that will help us to reduce the amount of disease and live with a healthy community.
That's amazing. Can I ask you one more question about how aligned are you with Department of Health?
Department of Health is a strategic partnership. As you are aware, with the Abu Dhabi Global Healthcare Week, M42 is a foundation sponsor of this program, working side by side with the Department of Health. Without the support, without the collaboration, the partnership with the Department of Health as a regulator and as a custodian of the research program, none of this would be possible. In fact, the Department of Health represents the mindset of the leadership of the UAE, being pioneers in research, being pioneers in introducing the latest technologies. And I can't tell you, maybe 80 to 90% of the research programs that we have established or are going to establish are in collaboration with Department of Health. So we go hand by hand.
That's amazing. And that's how we are achieving this amazing result, in fact, globally. Thank you so much, Safia.
Thank you.
Mr. Goraf, let's go to CCID now and hear from you about your experience. Can you outline the impact of AI on advancing digital health and enhancing decision-making in clinical care? Can you tell us about CCID experience in this area?
Yeah, sure. Thanks, Fatima. I think at CCAD, we believe that...
Can I invite you?
Okay. At CCAD, the AI revolution will transform healthcare. That's the thought process. We have already started looking at what will it look like 5 years, 10 years from now. We believe that it will change for us as patients, as well as it will change for us as providers, how we provide care. If you look at from a patient perspective, it will move to a more longitudinal care model where today when we walk into the hospital, you get treated for the current episode of care. However, once with the advent of wearables, AI-assisted chatbots, as well as your personal assistants, a physician will be able to identify how you're feeling today, yes, but also how you were feeling 24 hours back, 72 hours back, or even a week back. And then they will be able to have a more 360 view of you as a person, you as a patient. And the care would move more into being treating the condition to being more holistic. So it will be more about move from treating the problem to preventing the problem. And I think as we have been discussing here that the care model will need to move towards a wellness-based care model. I think that's where the care is going. But now looking at CCAD as us as providers, I think it's a big challenge and we need to face up to it. Today, we are excellent at providing care for patients who are within the hospital.
You are very good.
Yeah. But I think we will have to challenge ourselves, we have to extend ourselves to be able to provide the same care for patients who are outside our four walls. We will need to set up virtual care teams who can track and monitor the entire patient journey from home to the hospital to post-care. And I think this will not be possible for our physicians and nurses till there's a strong technology platform or a backbone in place, where all this data that's coming from different sources can come in, where you have analytics that can tell you about the trends, as well as looking at AI or large language models like M42, which can help with clinical decision support for our physicians and nurses. So we believe the change is coming. I think the least we can do is to start putting together the foundational elements for how the healthcare will look like tomorrow.
Absolutely.
That's how we are approaching it.
Thank you so much. You spoke about digital health also. The morning we have with us Dr. James Mould, who was speaking about 1 billion of data coming from biointelligence and remote monitoring. Do you think that this can be one of the technology who will be supporting your care, the model of care with the continuity of care that Cleveland Clinic is delivering?
Definitely. I think remote monitoring, being able to track patients' health when they're at home, when they're not in your facility will be paramount. And it is technologies like biointelligence and the other such technologies which will become crucial to provide that last mile of care. I think that will be essential.
Amazing. Then there is a lot to come from Cleveland Clinic. Thank you so much.
Thank you.
Mariam Al-Dahiri, happy to have you on board today.
Thank you, Dr.
Thank
Fatma.
you. We spoke about a kind of operation on a clinical side. We spoke about the digital and the remote monitoring. Part of the operation is procurement and supply chain. Then my question to you, what role do you see AI playing within supply chain management in healthcare?
Well, I think, Dr. Fatma, AI is going to revolutionize the way we deliver healthcare generally, let alone the operational side of healthcare. It is quite important to understand the value that AI brings to the table when we speak about AI. And the reason I'm mentioning that is the ability to produce predictive analysis these days became something really, really big. And I think, specifically in supply chain, our ability to predict what is coming, whether they are shortages, new medications, market trends. And if you look at seasonal diseases, if you look at flu, for example, now we know, for example, between this month and this month, we're going to get, this is going to be the flu season, and we've got good predictions of what medication will be needed around in the UAE. And I think that is very helpful in terms of demand planning generally within the UAE. The other quite important thing, which is, in my opinion, key to what we do, is our ability to automate operational tasks or tasks that are quite high in volume and small in volume. So high in volume, and low in value. So if you look, for example, at the reordering points where you manage your inventory, we can make sure that through AI can predict what is the right min or the max level, and you can have your reordering process automated. That's quite important. Another quite important thing is that there are a lot of efficiencies that were realized through other ways other than the AI. And I think AI came to improve these efficiencies and even add more to it. And I think in the next couple of years, we will find out that majority of the AI capabilities are not yet tapped on, which I believe will be able to achieve more and more within time as we understand, as the machine learns better and we understand the use of technology.
It's amazing to have you, in fact, tackling the area of procurement. And I know a little of your work. I know that you started this very early, okay? How do you feel about it as an Emirati, in fact, pioneer leader in healthcare?
I think it is important to recognize the role of the organization in supporting such ideas. So the idea of having a good technology team that understand operations, the idea of having or being blessed with leaders who understand the importance of AI, and also the youngsters among us who keeps talking to you about all of these new things in the market, and you keep exploring. So I think we're blessed to be where we are, and I think the only reason why I started ahead of anyone else, I think because of the challenges we face on daily basis with our operations, and I think that have driven us to explore further. But nevertheless, the idea of being the first doesn't mean that we have reached our goals. We will continue improving and learning as we go.
That's amazing. Thank you so much, Mariam. Claudia, as a Senior Director of Operation in HealthPoint, I want you to summarize for us what's going on. My question to you is, do you think we are prepared to make the most of what AI has to offer? How do you think we can achieve this? I know that you love education, awareness, okay? This is your area. I want you really to tell our colleague, but to tell the audience, where are you on this path?
I think to answer first, Dr. Fatima, to the question, are we ready? Look around us. We are in a city that is more than ready to receive AI and technology. We have our leaders, our regulators reinforcing it, and we work in an organization that is breathing it. So we are ready. The question will be, how can we keep the speed, right? AI, data analytics is entering healthcare in an amazing speed, a speed that we cannot predict. The key point will be the pillar of knowledge and the pillar of awareness. And I echo yourself, is education will be a key. So when we're talking about data in healthcare, in interpretation of data analytics, it's very important that healthcare providers have comprehensive training and comprehensive awareness what that means. And we cannot do that ourselves. This is a complete integration between data scientists and healthcare providers. So we can make conscious decisions. We can make decisions that can positively affect our patients, can positively affect lives, and positively affect the organization. So we have the resources, we're implementing several workshops, so we are ready. But this is from the healthcare side, from the caregiver. But what about the patients? So there's where our awareness and knowledge needs to align is in alignment with the vision of the country into empower decision making, empower preventive medicine, empower health. If we think that with the access that we have to care now, we also need to have access to that education where makes AI part of that education. Patients cannot have access to AI diagnostics, can have access to genomics, can have access to preventive medicine. But are they fully aware? This is what we need to use our portals, our education materials, and do a presence of this subject to our patients. This will create a change in lives, a change in healthcare landscape, and of course, I think will change very much the way that we will see care in the future by empowering our patients to make the right decisions.
Thank you so much, Claudia. In preparation to this panel, I want to share with you that I was sharing a question in my LinkedIn, and I know that I see several faces from my LinkedIn. One of the questions was about AI. When I asked it, what is the most challenging, in fact, that they are finding with AI? And the first answer with the 65% was no clear vision from the leadership. This is not applicable to our leadership because clearly our leadership from the top, okay, to our leadership who are on board here, okay, are having clear vision. Thank you so much. Thank you. Thank you so much. Thank you so much. يعطيك العافية. Thank you. Let's have one photo. It's very amazing.
Dr. Fatima, if we can please, yes, thank you. First we'll take just you guys. I will join you. Thank you, and I will join you for this one as well, because that was such a wonderful panel discussion. A cast of thousands, as we said. Oh, sorry, the photographer has walked off. Maybe, Claudia, you could take just a photo in yours. Thank you. Fantastic. Thank you so much, ladies and gentlemen. Another round of applause, and we're back in 2 minutes. Thank you.